Hello there, I'm Esther Carr, Project Manager on the Prehabilitation programme, and this morning we just wanted to talk a little bit more about what prehabilitation is. It's a fairly new concept in medical terms. If we went back 10 years we probably wouldn't even ever have heard about it. We just thought it would be useful to talk through what prehabilitation is and why it's an important part of the surgical pathway. So this morning we're lucky enough to have Dr. James Durand talking to us about prehabilitation. So James, do you want to introduce yourself?
Thanks Esther. My name's James Durand. I'm a doctor working in anaesthesia and intensive care, and I'm one of the research fellows for the Prehabilitation programme.
Thanks James. So it probably makes sense to start off talking about the surgical pathway and the process really, and what actually happens to the body when you undergo an operation and during the recovery process.
Sure. So I think it's worthwhile starting and thinking a bit about how the body initially responds to all kinds of surgery, in particular major surgery, which is what a lot of our patients are currently preparing for. So you will have agreed on an operation with your surgeon and the medical team looking after you that is designed to get you healthier. It may be to deal with a problem that is limiting your health and well-being, may be for something that is potentially life-threatening. So the idea of undergoing the surgery is to benefit your health in the longer term. The issue is that in the shorter term, certainly your body doesn't necessarily get that message. And actually, immediately following a major surgery, it responds a little bit like it's undergone an injury. So what do I mean by that? Well, immediately following your operation, your immune system is kicked into gear. There is a substantial inflammatory response that affects all of your major organ systems and puts them under a pretty significant amount of strain. So that includes the heart, the lungs, the kidneys, and pretty much all of your major organ systems. The way that your body is placed to respond to that often has a significant say in how things then go afterwards. And for the vast majority of patients, we hope that will lead to a smooth recovery after operation. But for some, unfortunately, that stress can lead to complications developing after their surgery. Okay,
thanks, James. So as you said, unfortunately, some people do experience complications during an operation or in the initial recovery process. What are the common complications from surgical processes, and what impact does that have on the body?
The stress that the operation places on anyone undergoing a major surgery means that at least for a short time after your operation, you're going to feel a little bit reduced in the things that you can do. Most people would expect, for example, to spend a day or two mostly in bed after the operation. And what we hope to see then is a steady and a smooth recovery back not only to your level of health before you had your operation, but ideally beyond it, which of course is the purpose behind having your operation in the first place. Unfortunately, a number of patients encounter complications after surgery. What do we mean by that? Well, there's a range of different things that can happen, from minor to more major complications, and issues can include things like difficulties with the wound healing, problems with chest infections afterwards, so development of a pneumonia after surgery, and also issues with your other organ systems such as injury to the kidneys. All of those things essentially complicate that recovery process, and it means it is slower, so it takes longer for you to get back to where you were beforehand. And unfortunately for some patients, it sometimes means that they never quite recover to where they were just before surgery. So the lines on the graph will differ for different people, but for some patients that might mean the difference between them leaving hospital in a state of independence, where they're able to go about the activities they were before they came in for their operation, to a place of dependence. And in the worst case scenario, sometimes that can lead to patients not being able, for example, to be discharged back to their own home. So your likelihood of developing a complication is controlled by a lot of different things. Some of those we can't do a great deal about. For example, your age. So we know that older patients are more likely to have complications afterwards, the type of surgery that you need, and also any background chronic health problems that you have. Thankfully, there are things that we can do to bring that risk of complications down, an action that we can take before surgery to ensure that you have the smoothest recovery possible and get the best outcome after your surgery. So the sort of things we're talking about are things to improve your fitness. It can be activity to stop smoking, to control your alcohol intake, to sleep better and for longer, and also to improve your nutrition before surgery. And that whole process to improve both your physical and mental health is known as prehabilitation. So what we hope to see in a patient who's undergone some prehabilitation support is that they make that smooth recovery back to their initial level of health and ideally beyond it. And the key thing is that even if, having undertaken that activity, they're still unlucky and they encounter a complication after their surgery, they are in a position to essentially weather it and recover from it more effectively, so that when they leave hospital, they're at a level of health and a level of functioning that is much closer to where they were before their operation took place. And that's really where PrepWell and the PrepWell programme comes in, is to help you with that structured prehabilitation support before your operation. So there's 3 broad aims to the programme. We'll be supporting you to make the best use you can of the time before your surgery. We will show you how to go about engaging with support to improve your health and well-being. And really this is about putting you at the centre of the team that are looking after you around your operation and letting you take some control about how well you recover after your surgery. So we have a range of things on offer, and we have a series of video podcasts now covering some of this support in a little bit more detail. But we'll be looking at things like physical activity and exercise to improve your level of fitness from where you are to start with. Talking about getting you to stop smoking before surgery, to reduce your alcohol intake to a safer level, to eat more healthily, and to sleep more, to sleep better, and also to improve your mental health and well-being before your operation. And the thing to know about all of this is they support one another. So for example, eating well beforehand will help you with your exercise training to get maximum benefit from it, in the same way that stopping smoking will, and other factors that work together to overall improve your health, well-being and your readiness to undergo the operation that you're preparing for.
So we know that leading up to surgery can be quite an anxious time for people, and if they've got a lot of or a number of health issues to address, that can sometimes add to that anxiety. Any advice there, anything that we can say to help these people?
Absolutely. We are really mindful of the fact that the approach to a major operation is a stressful and an anxiety-provoking time, often potentially right after following potentially what can be quite a scary diagnosis. So trying to tackle some of these issues in the approach to surgery is not the easiest task for people. And I think what we would say is, as a team, we are here to support you. We're not here to judge. We're here to take you from where you are right now in terms of your health and try and get you to somewhere that is better than where you feel you are. And it's a chance really for you, as we said, to kind of take some control about how this process goes for you. And we raise these things not really to cause alarm or to add to your anxiety, but we are trying a little best to be here to support, I think, you in the approach to your operation.
Brilliant. Thanks, James. And as James mentioned, there are a series of videos and resources available to talk more in depth about each of these risk factors that we've talked about.